Dr. Leah, a woman says, after chemotherapy, sex is not the same. How can I go back to the way it used to be? By the way, we're very sorry for what you're going through. Dr. Leah, your answer?
Yeah, going through chemotherapy can be very stressful and certainly affect your sex life. You're probably feeling a range of emotions, anxiety, anger, self-consciousness, depression, and grief, which all affect your sexuality. If you had a surgical removal of your body part, it can also affect your sense of self and body image. Some of the side effects of the treatment can also lower your libido, and chemotherapy can have a permanent effect on your hormones.
So how do these factor into someone's sex life, for example?
Well, the most common sexual change for cancer patients is really loss of desire. For women, vaginal dryness and pain may be a problem, but most are still able to reach orgasm. You may need some time for climax and more stimulation to really get there. Finding the most helpful remedy is going to take some time and patience, but it's definitely doable.
And what is a good remedy, Dr. Leah?
So you want to talk to your doctor about how you're feeling right away. They may be able to offer some treatments that will help, like hormone therapy to boost your sex drive and restore vaginal health, or consider counseling or sexual therapy to just really talk about how you're feeling. And do talk to your partner about how you're feeling too, and also like your worries about what you're going through so that they are able to understand everything. Discuss how to work through it and find new ways to be intimate. What about kissing and caressing and mutual masturbation? Just shake things up by bringing in a sex toy if you haven't done that yet.